Great. Well, welcome everyone. My name is Heidi Hedberg. I am the Commissioner for the Department of Health, and I'm very excited to welcome you to our very first Rural Health Transformation Program Impact Series. So today, this is the agenda. It is packed. The 60 minutes is going to fly by. We're going to talk about what is the Impact Series. We're going to do a quick recap of the Rural Health Transformation Program overview. And then we're going to talk about transformation. Fair warning, this is a conversation with all of you. So I want you to be taking advantage of your chat function. If you look down, you'll see the word chat. You'll get some instructions pretty soon. And we do have some polling questions, and we will instruct you on how to complete those polling questions. Next slide. Okay. So I am very excited to introduce our Impact Series facilitators. With us today, we have Dr. Ann Zink. She is an emergency medicine physician. She also has her own consulting company, and she's a professor at the Yale School of Public Health. In addition, we have Dr. Lisa Rabinowitz. She is also a practicing emergency medicine physician, and she also has her own consulting business. So thank you both very much, and I hand the baton over to Ann and Lisa.
Wonderful. And thank you, Commissioner Hedberg and the entire DOH team for really creating this space to explore rural health transformation. We are really excited to come together, find ways that we can innovate and partner as we really envision how we can impact rural health in Alaska. Thanks also to all of you for making time to connect, and thanks to the work that you're already doing throughout Alaska to improve the health. We really want to make this a brainstorming session. So part of this series is finding ways to broaden our impact, and collaboration is the key. So please introduce yourself, put your name, your organization in the chat. Let us know what interests you in terms of projects, what you're hoping to advance with rural health funding. And don't be shy, put your email, your contacts, so we can create synergy even outside of this webinar as we kind of create this community of practice that we can transfer through this whole process with the funding. And next slide, please, Trish. So DOH has worked very hard and created a really transparent process with a lot of helpful resources. So we encourage all of you to check out the website, which has a ton of great information. There's also office hours that are really technical assistant about the application process itself. Stay tuned for dates for the in-person regional planning meetings. That's where we can help gather community input and insight into the unique needs for health innovation. And today, as Commissioner Hedberg said, we start the impact session. So these are really designed to explore the 6 initiatives or focus areas that DOH has identified after feedback from all of you and the communities that can really help transform our health delivery systems. And next slide. So what is an impact session? What are we going to accomplish with this? And they're really a series of 6 sessions arranged around those impacts. And it's meant to be an interactive forum driven by state priorities and you, the participant recommendations. It's important to note that your organization may touch on many of the 6 initiative areas, and we want to encourage you to come to as many that align with your vision as you can. And we want to use this time to exchange ideas, learn lessons, including ideas that don't work. So I think that's an important part to this. We've all been involved in projects that don't go quite as planned. We have to kind of reinvent them, and often a lot of magic can come out of that. Really, our focus and excitement is around the potential to collaborate just to create that bigger impact. So we also want to encourage feedback because this needs to be valuable time for all of you. Quick reminder that this impact session is not for technical assistance, And project approval or endorsement are not going to be what we're talking about today. Dr. Zink and I have no stake or role in selecting the projects that get funded. And next slide. So it is about connection, and that's what we want to really highlight today. So connecting stakeholders around the state, around these initiatives. This includes tech experts and vendors that could maybe add that added expertise to your project. So keep an open mind as we go through this. Fostering collaboration, learning and information exchange, building a shared vision for transformation, and Spark. Really trying to move past the basics and let's really move past that. Think innovative. How can we really transform this system? This is a huge opportunity, and I think if we work together, we can build something incredible. And as I mentioned before, there's going to be recalibration on projects, and DOH has really built this into the system. So this is an area where we can come together and kind of strategize and plan for success together as we go through this. And then identifying and promoting partnerships. We want to really work on that collaboration because we can just create so much more with our projects that way. Okay, and next slide, please.
Great. Thanks so much, Lisa. And thanks to everyone for the patience with the chat. As you can see, it is now open, and it's great to see everyone putting in their name and information and what they are interested in doing, and encourage you guys to reach out to each other to create networks of networks outside of this. And then we will be using this information and the information you provide here with us to help us to facilitate these sessions moving forward, as Lisa mentioned, to make this as useful as possible. So just bringing us back to like the overall picture again, as you all know, this is a one-time funding that is coming out over 5 years from the federal government, with $272 million being allocated for the first year, and really appreciate just robust interest in the LOI, as well as great ideas that were submitted, and want to make sure that as Commissioner Hedberg and team have selected, this has the biggest impact it possibly can. And so today's focus is really on the impact for healthy communities. If you go to the next slide, you'll see that this is, again, this targeted kind of multi-year stakeholder process. I would say that there is expectation that what is proposed in year one may not be the thing that is actionable by year 5. And so there's opportunity to learn from experiences. There's opportunities to learn from each other. There's opportunities to partner in new ways. So you may have submitted something in year 1 that may look really different from year 2, 3, 4, or 5. The goals in the application are the same. However, the partnerships and what is submitted can change over time, and why we really want to encourage this community of practice to build with each other to have the greatest impact we can with these limited dollars that are coming into the state. If you go to the next slide, you'll be able to see that here, we're really just talking about like what the vision is. And we decided to put this slide in so that you could just have a real clear sense of what the department really emphasized as the vision for these funds. There may be projects that don't fit specifically in these funds, and that's okay. Not everything will be funded by this. This does not have to be the end all be all. But the goal for these funds was to ensure Alaskans can get affordable care to stay healthy, with a real focus on primary and preventative care and having easier access to mental health specialists, emergency and long-term services. And to do that, reducing burdens to providers, as well as increasing the workforce and using technology and innovation to the systems to help deliver high quality, convenient care together. Moving on to the next slide. You can see that there was kind of these buckets in the ways that the department put them together. And these are going to be the 6 different areas that we're focusing our session on specifically. So this one, we're right now today with the healthy communities. We'll be having another one on healthcare access, one on healthy beginnings, paying for value, strengthening workforce, and sparking technology and innovation. You can come to as many of them as you would like to, or as few of them as you would like to. They're also recorded, so you can go back and learn. But we're also hoping that this will become a community of practice where you guys get to know each other, work with each other to kind of build on techniques. There's more grounding in today's first webinar, but then moving forward, really going to become more specific on specific topics and areas of interest. Moving on to the next slide, I will turn it back over to Lisa.
Perfect. So here's where we start to have a bit more fun, and let's find ways that we can kind of inspire and help each other as we reach to our greater innovation, focusing on healthy communities. And if you go to the next slide, why are we focusing on healthy communities? And it's really because this targets the challenge of remote rural health and how we can invest in preventative care to help the root causes of poor health. That's really the bottom line. And with that, there are some approaches that the Department of Health came up with to use as a framework for this funding. And these are pretty important as we move through this, that we keep grounding ourselves in these approaches. So, enhancing access to preventative primary care services, evidence-based screenings, and coordinated care. Expanding consumer-based digital tools, population health infrastructure and management systems, and community-based workforce capacity, which we'll see over and over again. Promoting healthy lifestyles with culturally appropriate community education focused on nutrition, physical activity, and chronic disease prevention. So all very useful. We just need to keep coming back to that as we kind of look at this funding. And as I mentioned, there is some crossover. So you'll see workforce capacity. It's important in healthy beginnings, healthcare access, and obviously in healthy communities. And next slide. So state of the state, and really as we look at healthy communities, there's a lot of great work already happening all throughout Alaska. There's some great examples of things happening right now, the Fresh Start program, mobile integrated care, but more than anything else, really the relationships are important. So particularly the tribal and community partnerships. But we still have a lot of challenges as we look around the state. We've got a high chronic disease burden. We've got a lot of social isolation, behavioral health challenges, such as our suicide rate being twice the national average. In the community, there's lots to be done for lifestyle and community infrastructure so that we can have everything like clean water, sanitation, supplies, and be able to move forward with all of these projects. And I really want people to start thinking like, what else do you think are the strengths, the challenges that we should consider as we're looking at healthy communities? How do we get to where we want to be? And next slide. So I'm going to turn it back over to Anne, and we're going to move forward with the fun.
Yeah, so I've been watching the chat box and it's really fun to see people putting in, yeah, I'm interested in decreasing TB rates, whatever that looks like, or I have a company that does X, Y, or Z. So make sure you're taking some time to kind of look through there. What we also wanted to focus on is some potential uses for these. We don't want to block you in, but really to kind of show some blue sky thinking, and we're going to do some exercises here with you all. But this may be consumer-facing digital tools to help deal with chronic diseases. Lisa had just mentioned the Fresh Start program with Alaska, and you can see that called out specifically in the Alaska application, how to increase that across the state. Data infrastructure to support population health. And again, that will be re-emphasized in the data one, but was also important here, particularly with showing long-term sustainability, the ways that primary care and preventative services, and the huge role that communities, community health programs, wellness programs, community-led regional delivery, TA support. And again, remember that what is happening in year one can be different than year five. I think in conversation, this is a very different funding opportunity than we've seen from the federal government in the past, where this isn't a one-time grant that then goes out, you got to put your whole application in and everything happens. Every single year, the state has to report on it, gets reallocated money and kind of goes back out again. So it has to stay along those application lines, but these are all things to be thinking about and wanting to encourage people to think in an iterative process. If you go to the next slide, you'll also see different ways that you can break up these groups. So this is where we were going to have you guys do a poll if this all works. So we looked at the application from the Rural Health Transformation and put in there things that were priorities for healthy communities. And it's hard to choose and what things happen. So we would love for you, I don't know, Tricia, if we're able to launch the poll, to go ahead and rank these in what you think is an order of priority. And that would help us to see what you all are most interested in, what we should focus on for future conversations. Trisha, how does that look from your end? Ah, looky, Trisha just magically shows up the poll. There it is. So you'll see on your poll box, not a priority, somewhat a priority, or extremely high priority. Would love to see how you prioritize these as a whole. And as you are thinking about this, I am going to just call out, Laura had asked if we can potentially collect what's happening in the chat and have a way to share that. And so we'll work with our team internally to see if that is doable. So I just wanted to recognize, Laura, that we saw that as we're seeing a lot of other names come in and out. Trisha, I will let you close the poll when you think most people have gotten a chance to respond and be able to show it. I feel like Trisha's our magic wand on the back end here. If for some reason you can't see the poll, and we understand that that sometimes happens, it should show up right on your screen. It's where I can see it right here, but you can also put it in the chat box, and that is helpful for us as a whole. I see a vote for behavioral and substance abuse from someone in the chat. Trisha, how's our poll looking? Ah, there we go. We have answers as a whole here. So that orange is extremely high priority. So big overall winner here with behavioral health and substance abuse as a major focus, as well as chronic disease and self-management. So this is very helpful for us to think about the kind of how we can prioritize future conversations within healthy communities to help to support these sorts of work. Culture and traditional wellness, youth engagement come up pretty high, as well as water sanitation, recreation, exercise, and nutrition diet are all similar-ish, maybe with a slight preference to nutrition and diet as a whole. So super helpful to see what you guys are prioritizing in this group. So thank you for taking your time to put that together. Going on to the next slide, turn it back over to Lisa.
Yeah, so this is again where we kind of jump into the blue sky thinking and really, use your raise the hand function. We want to get a conversation going, but magic wand, if geography, funding, and workforce were no longer barriers, what would it look like for someone in Alaska to grow old or recover from serious illness without ever having to leave the community? So let's get some ideas going in the chat and some conversation around what are some cool ideas that people have. And feel free to raise your hand and come off mute.
So Lisa, it looks like we got a couple hands raised, if you can see them.
I cannot. So
Oh,
let me see where I'm at.
well, I'll start then while you're working that.
Okay.
Brian, I got you first. Brian Hogan. Brian, can you hear us? Brian is on mute. If you can unmute yourself. Brian, while you're working on that, I'm going to head over to Sean.
Hi, good afternoon, folks.
Hey, we can hear you well.
Perfect. Hi, my name is Sean O'Sullivan. I work with Alaska Dialysis. I'm actually based here in Texas, but got some folks from our Alaska team on the call. One of the things we're working on is helping folks in rural communities dialyze at home. So for folks who are living with end-stage renal disease or end-stage kidney failure, have the option to stay in their local community instead of having to relocate to an urban area and have better outcomes in the safety and comfort of their home. So that's one of the ideas we've got on the table in our letters of interest.
Awesome. Thanks so much for Brian. And it sounds like being able to dialyze at home is part of your Blue Sky mission. How about you, Brian? Brian Hogan, we'll try you again. Still working on Brian. How about Tanya Muldoon?
I'm here. Can you
There
hear
you
me?
go. Now we got you. Go for it.
So I kind of take a different look at this. I actually have another proposal in another area, but it answers part of this question. And it was really about bringing in education into the community to be able to provide personal care services and hopefully grow additional in-home care services in the community and start perpetuating the process so that we could potentially build eventual hospice and skilled services in our smaller communities.
Thanks so much, Fredonia. Thank you for bringing that up and taking another direction. That's the whole point of this, is to get a whole bunch of different ideas on the table and getting people connecting. So thank you so much. Paul, great to see and hear you. Over to you.
There we go. Now I can hear you. Hey, thank you, Dr. Zink, Dr. Rabinowitz, and Commissioner Hedberg. Yeah, our idea is that we create a CNA elder care workforce. And we treat it like we do a lot of the provider side, where we have people serve in the region 30 days, 30 on, 30 off. And it allows people to go home and be where they want at their end of life. That's a big need for our communities. So that's what our focus is in one of our LOIs.
Great. It's so great to hear your ideas, Paul. Thanks for coming. Zoya,
And
it looks like you're up next.
I'm already hearing a lot of crossover. So a lot of in-home care, kind of networks of care, being able to create a system where people can be supported at home and kind of dialysis at home. All of that is kind of interplaying already. So keep them coming, you guys.
Hi, this is Zoya Radner with Rural Healthcare Financial Partners. Our proposal is really to help get care closer to home, make sure that anytime a community member in rural Alaska has an urgent care need or primary care need or specialist care need, they can get to see their primary care clinic specialist provider really quickly without any delays, and improve the time frame for if they need a specialty referral to cardiologist or any other specialty that may not be available locally. They can get a telehealth referral through some good coordination, or get quickly transferred to appropriate care setting outside of their community, and have all the prerequisites that are necessary for them to be seen and evaluated available to them at that appointment. So there's not a chance that they come from their community and they don't have enough labs or information for the specialist to make the determination. And obviously, we would love to see this increased access to primary and specialty care to reduce avoidable ED visits. There's definitely lots of statistics out there that 80% of emergency room visits are preventable. So that's what we're hoping to do, and utilize that funding that frees up in the communities and healthcare system for more primary care access.
Great. And as I continue to call through, just as Lisa had mentioned, there's a lot of synergy, but would also like to connect people in the chat box. So Alaskans, there's some comments about, don't you have a lot of fresh water? And there's comments about we need to get rid of honey buckets. This is a chance for those who may not know Alaska's landscape, but may know technology or may know other services well, to connect with Alaskans who knows Alaska very well. Lisa, I'll turn it over to you.
Yeah, and I think the other thing that I'm seeing is different areas around Alaska. So I want people to consider that you may be in a specific region, but as you start to look through the chat, there's people interested in that same thing in a different area of Alaska. So how do we combine forces? How do we kind of use that to extrapolate and make a larger system that's even more effective? So there's a lot of that happening right now. And I am still having a hard time seeing people that have their hand raised. I see Lisa Sauter. Do you want to come off and?
Sure. Can you hear me okay?
Yes.
Oh, great. Thank you so much again for the opportunity to bring everybody together. It's always so great to see what everybody else is trying to work on. Again, I'm Lisa Sauter with Alzheimer's Resource Alaska, and we're really interested in this opportunity to work with our partners statewide to make sure that people are able to age in place in their own communities and their own homes for as long as possible. And one of the big things that we need to be able to do in order for that to work is to make sure that caregivers feel completely supported. And whether that's done virtually or through peer groups in their communities, providing additional training for both workforce and family caregivers. And then again, making some funds available that are consumer directed to make sure they can have access to minor amounts of funding that may make the difference of someone staying in their own home, whether it's grab bars in the bathroom, a ramp into the house, some respite care, whatever services they may need. So those are some of the areas that we're looking at, and how do we help have regionally focused, care teams that are looking at what are the gaps in services and what's available, and how do we navigate people to those services.
That's great. I think that's hugely important. And again, I'm seeing a lot of overlapping themes here and already in my head thinking about some amazing networks we could get started. Jonathan Strong, why don't you come off mute and tell us your ideas?
Oh, great. Can you hear me?
Yes.
Oh, thank you so much. I'm also just excited for my name is Jonathan Strong with Strong Solutions. I'm a home and community-based provider in remote Kodiak, Alaska. And so me and my family have been doing home and community-based services here, everything from substance abuse. I came up here from California in 2013 to do drug and alcohol stuff with the Salvation Army, here in Kodiak. And so I've been here since then. And now it's, we do group home services. So we just kind of fill the gaps where they're needed. And so Kodiak, just being so remote, there's just so many gaps. And with our workforce challenges, of course, but the layer in home, I'm talking home and community-based services, but that touches every aspect of healthcare from emergency services to primary and so forth. The care, the case management layer, the social service layer of rural healthcare, I think has kind of, been challenging. And so a lot of people fall through the gaps. And so that's what I've been trying to do over the years, just kind of fill those gaps using innovative, strong solutions, I guess. But then when Commissioner Hedberg was talking at an AADD conference in Anchorage, I think in October, I knew about rural health, but I just figured all the big hospitals were going to eat up the funding, frankly, and big nonprofits and little guys like me wouldn't have a shot at any funds to innovate. But now I think we do. So I'm excited to collaborate.
Yeah, I think that's really the exciting part is we can get access in every community. If we do this well, we can make sure that all of rural Alaska is going to have transformative care. And I think that's really Department of Health, that's their goal. And I think it's going to depend on smaller organizations, larger organizations, and that's really where these partnerships come together. As we look at even things like bulk purchasing and tech that can help scheduling, all of that stuff, it can play a part. Let's have somebody else. How about Sammy? Abu Zaid, come off. Okay, well, we're waiting on Sammy. How about Justin Perkins?
Hi, you guys. Can you hear me?
Yes, I can hear you, Sammy.
Awesome. Okay, Sammy Abuzek, cardiologist, Alaska Heart. I think one of the great things that we think about how we can affect the whole state. So there's a lot of great ideas, but I think focusing on workforce and creating these residency and fellowship that we need to train our own workforce, and that can be physician, technologist. I think that would be great because we have huge shortage in the front line. As a subspecialist here in Alaska, I think we need to grow our own people. The second idea that he really, as we talk about prevention, and we can be innovative and we have the tools, we can screen the entire state of Alaska for coronary artery disease. And we have the imaging tools, the AI tools that we can, with simple things, we can really impact our 1 million shy of 1 million population, and we be the only state in the country that lead that and affect our destination really from outcomes, from population health, and be in the front line of all of that. So it's, as a cardiologist, I feel this is maybe our time because this is has been done in other nationwide, but also there is something special about that because we can prevent the number one cause of death, which is coronary artery disease. But also, it's not just being selfish in cardiology, but there's other diseases important as well. We screen for cancer, we screen for colon, breast cancer, we do mammogram, colonoscopy, but we don't screen for coronary artery disease. And the scope of coronary artery disease is going to change in the next few years, and we can have an impact there, and not just for a clinic or a population. I will go big with the entire state. So that's my idea. I hope to submit it sometime. I will work on it, and if anyone want to talk about it, please find me and we talk more about it. Thank you.
I think that's great. And I can see kind of dovetailing off of that, Aaron Osterbach in the chat, kind of talking about smaller communities needing the ability to provide trainings and feeling like you're constantly competing with the larger hospitals, and how do we create that equity for workforce across the state, which is another aspect. So I think as a homegrown whammy medical school physician, I'm very passionate about all the work that's being done right now to really grow our own. And I know that there's a lot of work being done at that, but there's a lot more to go. The other thing I want us to think about is, as Sammy said, he's talking about cardiology, but how do we create a network of preventative care like that for some of our chronic diseases that is not just cardiology? Say we pick three of the big ones. We talk about stroke, we talk about kidney disease. We can really link all of these, which I think is pretty exciting.
I guess I will just also add, there will be a workforce specific section where WWAMI and kind of much more discussion about workforce will be there. Again, this intro session is to kind of go to a big picture, kind of start to create that community. And then future sessions will be topic specific, where we can dive into one topic much more specifically that you can choose if that really matches with you. But back over to you, Lisa.
Yeah, no, that's great. So let's have somebody else. I had called on somebody before Sammy got on.
Yeah, that was me, Justin Perkins, Interior Region EMS Council. I'm genuinely enthusiastic after hearing everybody's ideas, because the entire time I'm just kind of checking the boxes on what we had proposed. To give you the short of it, we're proposing what's called the Alaska Remote Duty Paramedic Initiative. And it's essentially employing MIH principles, which I think everybody's kind of touched on, where we can use paramedics with additional training in community paramedicine and some remote duty component of that as touch points in a lot of these rural communities, doing the whole hub and spoke concept. In basically creating primary care islands. And I think in listening to everybody, like Dr. Bozet said, having someone that can go do those assessments, provide those exams would be paramount. The other thing is there's a lot of value added. Everybody's thinking about things in terms of primary care. I'm thinking about things from an EMS perspective, and we have EMS providers that can wear multiple hats. And so not only would you have this primary care island, somebody that can do community paramedicine, use telehealth,
And the
link
TV down
more
just a little bit.
specialists, but they can also
Thanks.
provide ALS services, right? They can be there for those emergencies, and they can provide additional support for education, training, public health initiatives, that sort of thing. So if anybody's interested in that, especially if you're in the interior region, please reach out to me, and I would happily share what we've got going on. And regardless of our HTP, this is something that we're going to be pursuing. So please reach out to me.
Yeah, I think this is all really exciting, and I think there's a lot of mobile care and EMS transformation that can happen. Look, we have a unique state. We have our own challenges that we're all well aware of. There's a lot of transfers from different areas to provide care, and it's not always possible to have all your care in your region. So I think it's complicated, but it's all doable as we kind of reimagine how we would have designed this from the beginning for Alaska. I think we can kind of start back at the drawing board and really come up with some amazing ideas. How about Alan Choi?
Hi, I'm Alan Choi with South Adult Services and in South Anchorage, and we are a startup. What we are looking at doing here is kind of twofold. We have a adult daycare services that is focused on technology, ergonomics, comfort, and we want to create a place that when you wake up in the morning, you are excited about going there. And I have visited several places on my own, and it's just as I age, I want to go to a place where I'm excited when I wake up in the morning to go to that place because there are so many different things to learn and such, you know, the excitement and the interactions. We actually are bringing on a AI generated robot called Mirakai, and it's actually pronounced Miraki, but which is has facial recognition, um, uh, actually does provides activities and is greets clients. Provides a lot of comfort in the way it learns how to speak with folks. In the other fold of this is rural housing, where we have 14 units that we're finishing out, that are going to be provided to rural residents. Anchorage being the rural hub for medical care, um, uh, and us having a shortage of housing, people paying $300 to $600 a night for a room. This will allow, for, at least for the first 2 years of the implementation of the program, for rural residents to reserve space and stay on a temporary basis for their medical care while they're in Anchorage and be greeted by Miraki.
Yeah.
But so we're really, really excited about it because it's something that is a passion for me personally. I have a student that is just finishing up his residency in at USC, and he at 25 years old having a degree in gerontology. That's amazing. And we're really excited about his the new generation of technology uh, and experience that he can provide from what he's learned.
Yeah,
So we're
absolutely.
really excited
And
about,
yeah,
yeah.
I think there's a lot of technology that we can integrate into all of these innovations, and I think it's going to become an important part as we move forward. Um, we're going to jump ahead to the next section right now and try a little exercise where we can get some other thoughts kind of generated on this. So, um, Trish, if you can move our slides ahead. Perfect. So we're going to run through a vignette and kind of refocus ourselves on healthy communities because I think we all get very excited and want to talk about everything broadly, but I want to kind of focus on the healthy communities. This is Alex. He's 15, lives in a small rural Alaska community and has asthma, early signs of obesity. Physical activity options are limited during the long winters, and Alex spends much of the day indoors. While local clinics provide care when needed, there's little connection between healthcare, school, community, and he doesn't have that support for that healthier lifestyle. So Alex and their family receive general advice, but no coordinated support around physical activity, nutrition, asthma self-management. Without easy ways to track symptoms or connect with peers, Alex misses school due to flare-ups and becomes less engaged. And next slide. So let's talk about Alex. What would a transformed system for Alex look like in Alaska? What's different for, we've mentioned families, providers, community. What pieces would we need to make this a healthy community for Alex? So let's get some thoughts going in the chat. And then if people want to also raise their hand, we can do some discussion. Okay, so visiting nursing care, we've got Margaret Mitchell is putting in there. I think, again, as we kind of look at broadening our networks and being able to have access, again, telehealth is coming in through the chat. These are important aspects for, reaching all the areas of Alaska. We also want to make sure that telehealth isn't just the end all be all. I think it's really important that rural health is just as optimized as health throughout Alaska. So we need to make sure that we build that in. Childcare is a huge, this is from Cassie, care, oh, I lost it. Hold on, you guys are going too fast in this chat now. I love it. Lots of great things. So Cassie says childcare is a huge component of access to health and early childhood screenings. And so I think that's a really good point. Another way that all aspects of healthy communities come into this. And health and wellness courses being taught in schools. So there's that education component that we're talking about. And how do we network that across, talking about asthma, but is there a statewide education summer camps? Are there things that we can really connect for similar patients experiencing a chronic condition like that? School-based nutrition, physical activity. I think, again, there's a lot of work being done on this, but we have a long ways to go. And a transformed system from Angela would not just tell a 15-year-old with asthma to stay home and avoid activity. Working on safe ways to move and stay engaged, simple daily movement tools, caregivers having clear routines, practice support, not guesswork. I think the other part to this that I want to kind of talk about is we need plans that kind of build with patients. So we've talked about kind of end of life, aging in place. We've talked about more of that pediatric, but how does Alex do this as he moves into Anchorage or goes off to college? How do we support him throughout those different transitions? And that's really what Healthy Community is all about. And help me out here. There's a lot in the chat.
There are so many great things in the chat. Part of the reason we did this kind of like way to vision or this vignette was to really focus the work that's being done with the goals that the state of Alaska has put out so that you guys can think about your projects and your interests to also align with those goals as a whole. So community health workers, there's a lot about peer-to-peer support, more coaching. I've been seeing a lot on literacy is coming up regularly, understanding, being able to have access to their digital records. I have seen also in the space, local foods and schools continues to come up, culturally grounded physical activity. So lots of great kind of components on here. Again, we continue to bring you back to the goals of the Rural Health Transformation Project that the Department of Health submitted to CMS because we've got to make sure that the projects really align with the goals of that and really wanting to encourage people not to just fill the potholes of today, but to have true impact so that tomorrow's future is healthier and brighter and to use these dollars to really have a significant impact moving forward.
And I'm impressed with all of the amazing ideas in here. I think this encourages me a ton that we can come up with some amazing ideas and help everyone kind of fine tune their projects as we move through this impact series. And that's exactly what we're hoping to get out of this. And then if we can go to the next slide. So Alex is now supported. We've done all this amazing stuff in the chat. We've connected, we've innovated, and Alex is doing much better. And let's go to the next slide. How can we help achieve this transformation? Like if we had to build this for him now, what partnerships do we need? So let's kind of focus on collaboration partnerships in the chat right now. Which areas do we really need to make sure we connect to create this healthy community? So schools, Carrie's saying, yes, schools, absolutely. Because then, especially in our rural communities, our schools can often be the hub for everything, right? It's where the community meeting places happen. Remote patient monitoring from Carol, and just needing to be able to have the metrics to follow. Talking about health aides, YMCA. Yes, and sorry to see Boys and Girls Club close. Definitely a loss to our community. I think there's ways that we can build those bridges in other ways. Tribal integration and city government education integration. I think that's a really important part. We talked about, communication and partnerships. And I think really focusing on culturally appropriate partnerships that make sense for rural Alaska and not just make sense for suburban or our urban centers, but really make sense in a smaller community. And I think, again, like Dr. Zink mentioned, that's really getting to know the state, the players, so we can use partnerships with tech or other things that can actually help our rural communities. Digital literacy, I love it. Absolutely. So we're going to move to the next slide, and we're going to talk a little bit about how to wrap this up and how we're kind of going to move ahead, because I'm just really excited about all these ideas.
Yeah, so many great ideas out there, and I think that that is going to be the real challenge of using these dollars as wisely as possible and trying to leverage them in so many different ways. There's more ideas and more work to be done than any one project is going to be able to do. And that is the great thing about Alaska. We're a small community, even a big state, where we can work together to solve many of these problems. And one of the goals was really to connect you all. So, feel free to continue to connect in the chat box. Also, stating if you're an Alaska provider or not may be helpful for our non-Alaska colleagues who are trying to figure out what makes sense in this state or as a whole. But some examples of healthy community projects that, again, really kind of that we've highlighted in here, you all have highlighted in here, include integrated wellness centers at clinics. So really thinking about which regions, which village clinics need to have that kind of hub and spoke model, nutrition program rooted in substance assistance, food and culture, chronic disease. We've talked about that with Alex and beyond. Chronic disease self-management. We've heard great examples of being able to do remote monitoring. We heard about, everything from, at-home dialysis to the importance of cardiology. We've seen comments in here about building up that workforce, but how do we empower individuals with technology to take care of their own health, and then layer on top of that the healthcare system to build from there? To build out population and health data infrastructure. So there's been some in this conversation about this, but knowing what makes us healthy and well can give us better ability to dive in deeper and to continue to iterate as we move forward. And then there's been a lot on the education and support and thinking about community health. We have amazing community health aid program in the state, not as much in the community health worker space. I know that many of our external partners have had a lot of experience with community health workers, and I see that as a real potential for being able to collaborate and learn from each other moving forward. Next slide. So those were some kind of just key takeaways. This is one of the challenges of this project, right? There's so many great ideas and projects out there. How do we condense that into a way that is effective, that gets the biggest bang for the buck and has the biggest impact as a whole? But to do that, we really need all of you all. So I think what I heard from today's session was a lot of excitement, a lot of different ideas and projects, a real need to connect people to people who are in state, who are working with it, with other solutions that may be from out of state, where there may be really great ideas. And in future topics, we're going to be much more specific on a specific theme, be it substance abuse, where we'll highlight different successes and highlight some state partners as a whole, but are also really looking forward to your feedback on what would make these sessions the most useful for you as possible. But Lisa, over to you on what sort of key summaries and takeaways you had.
Yeah, I think that's exactly right. And I think if we go to the next slide, we want to really kind of hone in on where we take this impact series for healthy communities. And I would love for you guys to put in the chat. You guys have been amazing populating the chat, but what's really the number one challenge you want us to tackle in this impact series? And we're going to kind of prioritize that for the next one. And on the next one, we'll have less kind of setting the stage for what this series is, and we'll be able to dive in and talk a lot more in detail. So if you guys can put in what your number one challenge is in this part in the chat box, that would be amazing. I think Dr. Zink is right. I think it's really easy to get excited about things. We need to keep going back to the focus of the areas that the Department of Health has submitted with their application, so we make sure that that's aligned for the funding. So I think this is going to be really important as we move forward, that we keep grounding ourselves as we move through this. And then, as we meet next month on Healthy Communities, we'll come back with what we prioritize from this poll and then dive deep. We're going to try to really take a couple projects that people bring up. We're going to use them as a tool to kind of move forward and come up with some solutions. And if you can go to the next slide, and I want people to keep putting in their number one priority. We talked about this being an ongoing series. So over the next week and following week, we're going to have the inaugural of each of these impact series. And so again, I encourage everyone to come to the ones that overlap or align with your vision for your project, and make sure that you're prepared to come in and work. These are going to be interactive and fun sessions. And next slide. So here's some more information about the Rural Health Transformation Program. And if you go to the next slide, there's also how to sign up for program updates, how to get more information if you haven't been on those email chains. There's a lot of, again, great information that comes out of this. So we're getting some excellent things in the chat. I think one of the things I've seen a couple times talks about sustainability. And I do think that's an important aspect, but I think a lot of this fund is meant to be transformative. So we are completely innovating, creating systems that are new and really this funding isn't necessarily to sustain it long term. We need to come up with different ideas for that. It's really to transform it. And it's more of a one-time fund, as Dr. Zink was saying. We need to build sustainability into it, but we need to think of this a little bit differently than a normal fund that we're trying to get out the door. This is something kind of a once-in-a-lifetime opportunity for Alaska. I think, we need to make this useful for everybody. And I think that from the chat, I can see a lot of excitement. The other thing that Dr. Zink and I have talked about is kind of as we focus this, if there becomes a big need for a certain aspect of healthy communities, we can also do some breakout sessions that would be really helpful. So that's another thing that we've thought about for this series. And back to you, Anne.
Yeah, we're working on the back end to try to capture all these comments. I saw some comments like it's moving too fast for me to catch. So it's great. I love the suggestion of breakout sessions. As mentioned, we have these 6 different themes. We'll be having about once a month sessions with each of the 6 different themes. You can come to as many or as you want, and we'll be starting to focus them after we do the first 6. In the next month, we'll kind of be focusing more on topics. So choose the ones that you want. We'll be working on breakouts and the ways that you guys can connect in different ways, as well as finding ways to asynchronously support each other. And I just wanted to highlight something that, Lisa Aquino had mentioned in it, like what's our vision as a whole for a state outside the rural health transformation? Just a reminder that this is a one-time transformation funding from CMS and from Congress on this topic, but this needs to fit into what's happening and how we're paying for value, what we're funding as a state, and how those things go together. So while this series will not address all of those, I am excited to partner with you all to think about how those things are sustainable, transformative, and we move long term. And so if there is a mechanism now to sustain it, great. Or maybe there needs to be built a mechanism in 5 years to be able to sustain it. But honestly, it's all of us getting together, having these conversations and talking. So I encourage you to continue to stay engaged. We're super excited by the engagement today. Over 300 of you with a lot of great engagement here in the back. And with that, I will turn it back over to Trisha. I don't know if you have any kind of closing comments about what is available and what isn't available from the Department of Health.
I am actually going to defer to Heidi Hedberg, please. Go ahead.
Great. Well, I want to just first thank you, Lisa. Thank you, Anne, for facilitating our first impact series on healthy communities. Again, I echo Anne, it was great to see the overwhelming response, and it was really hard to keep up with the chat and all of the conversations. A lot of great ideas. But the impact series is really about bringing all of you together as you're focusing in on this initiative, looking at who's doing what, cross-pollinating when it's working well and how we can replicate that, and really creating a community of really learning and really saying, if these are the health outcomes in my community, how can we shift it to be healthier? Looking at the system, how does the system need to change? And all of you play a role in this conversation. So I really look forward to our future impact series sessions. And I also would ask, there's been a lot of questions on updates to the LOI. Please go to our website. We continue to update our website on the status. If there's no update, there's no update. But we want to make sure that everyone has access to the same information. So that's your go-to resource. Again, thank you so much and take care. Bye-bye.